Good evening, everyone. Thank you so much for joining us this evening. My name is Debbie Stamps. I'm the Chief Diversity and Equity Inclusion Officer for Rochester Regional Health, and I'm joined this evening by Dr. Nana Duffy, our Associate Director for Diversity, Equity, Inclusion, and also Tracy, who is our ASL interpreter. We're really excited to bring you this topic this evening on the importance of health screenings. We know that the pandemic over the last 18 months to 2 years has really impacted our health. And we really want to get back to normal. And part of that is taking care of ourselves and our families. And our goal this evening is to bring you a conversation around the importance of these health screenings, what they are, and hopefully help you to make decisions on where to get some of them accomplished. We also want to help our vulnerable communities expand their focus from COVID vaccination and COVID safety to include other areas of wellness. So I'm just going to ask Dr. Duffy to join us. We're going to talk a little bit about the cancer screenings and a little bit about knowing your numbers.
Hi, everyone. So I want to just thank our ASL interpreter. Thank you so much for being here tonight. So let's talk about kind of knowing your numbers for a second and what numbers about your health are important to know. I'm going to start with BMI. That stands for Body Mass Index, and it's kind of a measurement of your weight as it relates to your height. And 18 and 25. If you are less than 18 BMI, it means you're underweight. If your BMI is over 30, that's technically classified as obese. So you want to try to make sure that your BMI is somewhere between 18 and 25. Another thing that goes along with weight is waist circumference. So kind of like measuring in inches the size of your waist. And this is important because people that carry weight around their central bodies, the abdomen, they tend to have more visceral fat. And what that means is that you tend to have more fat around your organs inside. So the circumference of your waist is actually an important number to keep in mind. And it's different for men and women. So women should be below 35 inches for their waist circumference, and men should be below 40 inches of their waist circumference. All right, let's talk about blood pressure for a second. This changed a few years ago. It used to be that if your, blood pressure was, say 130 over 80, you were doing okay. But the number actually lowered. So we really prefer your blood pressure to live less than 120 over 80. And the reason that this is important is because as blood pressure stays elevated for too long, meaning years and years and years at a time, you end up really increasing your risk for things like stroke and heart disease. So blood pressure should ideally be below 120 over 80. If it's above 140 over 90, that is considered high. And if it's between those two numbers, so, 120 to 140 systolic, and let's say between 80 and 90 diastolic, you're kind of in that pre-hypertension range where it should be watched and lowered if possible, but it's not, super high. So ideally, your blood pressure should be 120 over 80. I've actually heard a lot of cardiologists in the past say that your blood pressure should really be as low as possible without passing out. So, there are plenty of people that live with a systolic blood pressure in the 90s, and that's just their normal, and it's perfectly healthy as long as they're not dizzy. Okay, so that's blood pressure. Let's talk about cholesterol for a minute. get excited about cholesterol actually because I prescribe a medication for patients with acne that can increase the cholesterol. So we have to watch it pretty commonly with that medication. So a few different numbers to think about when it comes to cholesterol. First, you have your total cholesterol. That includes the good and bad cholesterol together. Ideally, you don't want that to be higher than 200. Then you have your LDL. The LDL is your bad cholesterol, and ideally, you don't want that to be higher than 100. And especially if you've ever had a heart attack or a stroke, that LDL number really needs to be below 100. And you know, the cardiologists get very concerned with someone who's had a heart attack or a stroke, and they see that LDL creeping up above 100. It's a big deal. The HDL, that's your good cholesterol. So HDL ideally should be above 60. It's a lot easier for women to get their good cholesterol up than it is for men. Men actually struggle a lot with their good cholesterol, and that's because of estrogen. So estrogen actually helps women keep our good cholesterol levels up. But so does things like exercise and healthy eating. Things like oatmeal and oats can really help with your cholesterol. Fiber can help with cholesterol as well. So try to get that good cholesterol above 60 if you can. And then triglycerides, which are somewhat related to cholesterol, triglycerides should not be above 150. So try to keep that triglyceride number less than 150. And if your cholesterol is high or you're worried about it, definitely speak to your primary care doctor about ways to change those numbers in a positive fashion. All right. Wanted to move on to something called hemoglobin A1C. Hemoglobin A1C is a kind of a measure of how much sugar you've been getting over the past, say, several months, maybe the past 3 months. And it's really a nice test because we can kind of see your history of sugar eating, not just yesterday or the week prior, but for months previous to the test. So it really gives us good insight. Your hemoglobin A1C really should live below 5.7. So it should be below that. If you are anywhere between 5.7 and 6.4, we consider that prediabetes. If you are greater than 6.5 and certainly greater than 7, that's diabetes. So you want to keep your hemoglobin A1C less than 5.7 if possible. And then there's another test that we use to track diabetes, and that's called a fasting glucose, and it's a instant measure. So it's a measure of how much sugar is in your bloodstream at that exact time, not for the past 3 months. And ideally, the test is done fasting. So what that means is that you have nothing to eat after midnight, and then first thing in the morning, you go get your test done. A desirable fasting glucose number is less than 100. So less than 100 is a good fasting glucose. Okay, so I want to just move on a bit to kind of age-appropriate cancer screening. One of the things that we've noticed happening with COVID over last year and certainly this year is we're seeing, unfortunately, cancers present later and more advanced than was really necessary because the patients have been obviously afraid to come in and get checked because of COVID and kind of worrying about the safety protocols in the hospitals or their doctor's office. And that's totally understandable. But there are many cancers that are entirely preventable, right? And so we just want to encourage people to start making those appointments for their regular cancer screening. So let's go through a few of the, common cancers and how they're screened. We'll start with cervical cancer. So this is obviously a screening test for people that have cervixes. So that's women. And the screening should start at age 25. The screening is typically done with something called a pap smear. So you would see a gynecologist for a pap smear. And between the ages of 25 and 65, you should have a test for HPV at least every 5 years. So HPV is called the human papillomavirus, and it's one of the main risk factors for cervical cancer. And so you should be checked for HPV every 5 years between the ages of 25 and 65. Now, some women have to get checked more frequently for HPV. So obviously follow your OBGYN's advice when it comes to your individual body, but at least every 5 years. If you are over the age of 65 and you've had normal pap smears for the past 10 years, you can actually stop getting screened for cervical cancer. Okay, I do also want to mention that there is an HPV vaccine that starts at the age of 9, and I believe it went up to the age 45. The upper category of who can get the HPV vaccine has actually increased to 45. So I'm actually going to be asking my primary care doctor about it to get it for myself, because it wasn't available when I was, a young girl. So the HPV vaccine actually can help prevent you from getting cervical cancer. And it's been a really amazing advancement in that field. And it's kind of a homegrown thing. It was in part created over at the University of Rochester in their vaccine research center. So just wanted to let everyone know that we can actually vaccinate against cervical cancer. Imagine that, a vaccine against cancer. Alrighty, let's go on to colon cancer. So Deb and I were talking with Dr. Bieber the other day, our CEO, and just kind of mentioning, we were lamenting over the fact that, people are still unfortunately getting colon cancer because it's really one of the most preventable cancers because the screening tests are so good. The main thing I want people to know, this is like big news, and it's a fairly recent change. We used to say that you should start getting screened at age 50 for colon cancer, but that has actually dropped to age 45. Okay, so starting at age 45, you can talk to your primary care doctor about getting screened for colon cancer. Now, usually that involves going to see a gastroenterologist, so a GI doctor, and getting a colonoscopy. But that's not the only way to get screened for colon cancer. So if a colonoscopy is not your thing or you're worried about it, there are other ways to get screened for colon cancer. So just have a conversation with your doctor. But that should start at age 45. Okay. Generally speaking, we stop screening patients for colon cancer past the age of 85. So if you're over the age of 85, most likely you've been told that you don't have to come back anymore for your colonoscopies. Okay. Okay, prostate cancer. So this is something that I haven't reviewed in a while, and I thought this was really interesting. So prostate cancer screening starts for the general population. Now this is for men, okay? So it starts for the general population at age 50, but for Black men, it should start at age 45. Okay, so if you're a Black man, you can kind of think to yourself, okay, I should start talking about colon cancer screening and prostate cancer screening. Okay, 45 is pretty young. So definitely something to keep in mind for our Black men. If you are not a Black man, if you're a white man or an Asian man, and you have a family history of someone that has prostate cancer under the age of 65, then you should probably start screening a little earlier. So, anytime you have like a strong family history of a cancer, even with things like breast cancer, usually it's recommended that you start your screening a little bit earlier than the general population. So it's important to, talk to your family doctor or your internist about what your family history is, because if you have a history in your family of people that have cancer at a young age, you've got to have that screening started for you a good number of years before your family member had their cancer, because the whole point of screening is to prevent cancer and to detect it early. Okay, like to detect it before it's actually clinically apparent. Okay, let's talk about lung cancer. I think that maybe not a lot of people know that you can actually get screened for lung cancer. I think in the past it used to just kind of be, if you got it, it just showed up and you were unlucky and you took your chances with whatever stage it presented. But you can actually be screened and should be screened for lung cancer. And screening for lung cancer typically involves a low dose CAT scan or CT scan of the chest. So it's like a lower amount of radiation than your typical CAT scan. And some of the criteria that you have to have in order to get screened for lung cancer, you have to be around 50. So between the ages of 50 and 80, at least 50. You have to also either be a current smoker or quit within the past 15 years. So, quit 2 years ago or quit 6 months ago, or a current smoker. And you have to have a 20-pack year history. So you basically take the number of packs a day that you smoke and you multiply that by the number of years that you smoked, and that's your pack year history. So if you smoke a pack a day for 20 years, let's say, you're 50 years old and you're still smoking, then that buys you a screening test for lung cancer. And it would be really amazing to catch something like that before it had a chance to get out of control. So if you are a smoker, even if you have no interest in quitting or you're not ready to quit, you can talk to your doctor about getting screened for lung cancer. Okay. All right, almost done. We're coming up on October, which is Breast Cancer Awareness Month, and so want to just let people know that at age 40, women can start to receive yearly screening tests for breast cancer. And typically that's done with a mammography. Now, this is something that I actually did not know. And I was in a slight panic when I was like 39 and realized that I could have had my first mammogram at age 35. So here's the thing. Your insurance company will typically not cover you to have regular yearly mammograms until you're age 40. But you can have your first screening mammogram to get a baseline, so to speak. You can have that at age 35. Okay, so that's something that I learned like way too late. Thankfully, I went in and was fine, but I could have gone 4 years earlier for my screening test. So you can get your first mammogram at age 35 just as a baseline, and then starting at age 40, you can have yearly screenings. When you are age 55 and older, you have the option of going every 2 years for your mammogram, or just sticking with every 1 year if you feel more comfortable with that. Okay, and then certainly, again, if you have any family history of people that have cancer at a young age, you would lower those numbers when you start getting yourself screened. So just talk to your doctor about that in terms of when to start. Finally, I wanted to just put in a plug for vaccinations. We talked about the HPV vaccine, but we're coming up on cold and flu season. And apparently COVID isn't going anywhere anytime soon. So it's COVID season 2. And so, besides encouraging people to go ahead and receive their COVID vaccines, and potentially a booster if you fall in that category of people that are at very high risk, people that are immunocompromised or elderly. I just wanted to remind people that flu is still around, so we didn't see much flu last year, not nearly compared to what we typically see, because people are being so careful with masking and washing their hands and staying home when they're sick. But the flu has not gone away. So it's important to become vaccinated against the flu, just like you would any year. And this involves children too. So our kids are back in school. Most of us have kids that are back in school full time. So it's important to get the children vaccinated against flu as well. Right, Claire?
Yes.
Okay, good. So we can open it up to some questions at the end. Deb, do you want to maybe close us out?
Yes, thank you so much, Dr. Duffy. That was very informative. I even learned a few new things myself.
Oh, good.
This is really good, really good. The pandemic has really highlighted for us the fact that the African American and Latinx communities have experienced COVID complications and death at a higher rate than any other race. And it's really important that we are still speaking about COVID vaccination, COVID safety, but also the broader picture of health promotion and health wellness. Early detection and treatment is really the key to sustainable, healthier lives. And we really want to make sure that we're available to answer any questions that you may have about this topic. There could be some challenges. Maybe you don't have a primary care physician, and we'll give you a resource that could help you identify and locate one. Access. We know that sometimes, between work and school, you might not be able to access a primary care provider based on the hours of operation. However, there's still alternatives. You may have a challenge with transportation. And we also know that we're trying to increase health literacy, especially amongst the communities of color, so that they are able to make informed healthcare decisions. We also can't talk about health and wellness without speaking about the trust and fear in the African American and Latinx communities. We know that there has been historic traumas, but we're in a better place now. There's protections that have been put in place. We've identified those situations and really working to eliminate healthcare disparities amongst the African American and Latinx community. When we think about solutions, there's mobile units. Rochester Regional, for instance, has a mammo bus that's out in the community providing mammograms all over. We know this Saturday, the 18th, that the mammo bus will be at the Memorial AME Zion Church on Clarissa Street. It's also going to be at the College of Health Careers, which is in the former Macy's at the former Arundecoit Mall on October 5th. There's walk-in clinics. So if you are interested in getting your COVID vaccine, for instance, there's many walk-in clinics at Wegmans, at Walgreens, Target, you name it. There's screenings that can be done by mail for the colonoscopy, for instance. There's a number of health fairs that churches are holding, that other community organizations are holding to get the word out to the community, to be able to be that resource. And, many pharmacies like Rite Aid, not Rite Aid, I'm dating myself, CVS is also available. And then if you are in need of a healthcare provider, if you visit the rochesterregional.org website and click on Find a Provider, there is a listing of providers that you can actually arrange an appointment for and start to have the dialogue around health promotion and health wellness. And so, again, I'd like to thank Dr. Duffy for being with us this evening. I'd like to thank Tracy and our marketing and communications team for this Facebook Live platform. And we'll open up for any questions. I see a link to our website for more information around screenings and immunizations that's been made available. But I'm not seeing any questions.
Hi, Kristen. I see Kristen watching. I think we can even answer questions after this finishes airing. We can kind of respond to people in the thread if anyone has questions about wellness and health screenings. Kristen is our amazing nurse practitioner here in the office.
Hi, Kristen.
Well, if you have any questions that pop up again about cancer screening or knowing your numbers in terms of wellness, just reach out to us and we'll do our best to answer your questions.
Wonderful. Thank you so much, Dr. Duffy, and thank you, Tracy. Have
Thank
a good
you
evening,
both.
everyone.
Stay well.